I think my lived experience of mental health is a bit all over the place. I grew up with an eating disorder, so that usually informs parts of it, but then I also had severe anxiety and depression for a really long time, and I still struggle with that to this day. I spent around 13 years in the asylum system awaiting for refugee status. So after sixth form I really struggled with my mental health because I kind of fell off this deep end where I couldn't go into further education, I couldn't go into employment, and I ended up in accident and emergency because of being suicidal. And there I started getting support by getting signposted to therapy, and my therapist started thinking about, oh, how can you find bits and bobs to do outside of the conventional route, as in going to uni and so on. And I started volunteering at the cathedral, and slowly from there I kind of became a workaholic where I was volunteering constantly in all different sorts of places and do quite a lot of mental health work across the way. Though that's not my day job, so I am currently have my own. Yeah, that's kind of something I do because I want to do to make a difference. But in my day job side of things, I have my own consultancy, Think Tank Hybrid, and then I'm at university currently doing a bachelor's in management for digital innovation and analytics. So that's me in a nutshell.
It's really remarkable that you come from like such a background and now you're
and I'm 22, which no one believes.
My name is Josefien Breedvelt, and I'm a Prudence Trust Research Fellow at the Department of Child and Adolescent Psychiatry at King's College London. Everyone will know someone who has been affected by a mental health condition, be it depression, anxiety. Through my work, working with young people, they tell me lots of stories and experience of what it means today to experience depression and anxiety. I've spent nearly 10 years in the field, working in a range of settings, and what I've seen throughout is I guess a lack of really understanding of what we are doing with regards to prevention and what interventions are effective and which ones aren't working. And that's really what's driving me. It's the mission of trying to understand what works for prevention, improving outcomes for young people so that ultimately they can live a life where they are not affected by mental health conditions such as depression and anxiety, and learn ways to handle those potentially emerging symptoms way earlier.
So we're going to start with asking Dinda about her experience. So
should I just start any time?
Yeah.
Fine, okay. Yeah. So hi, my name's Dinda. I'm one of the research associates with the Prevention Matters project. I'm a resident doctor by background, and I'm helping with some of the systematic reviews that we're doing.
Can you give us a sense of the scale of the issue of mental health problems in young people?
Yeah, mental health problems are on the rise, which we know from sort of previous research. So the latest data we have is that 1 in 5 8 to 25-year-olds has a mental health condition, and mental health conditions contribute such a large childhood disease burden. Just being in the 4 months that I've had as experience as a foundation doctor, we saw so many children come in with like psychiatric crises, and that's just like the emergency ones which are coming to A&E. I imagine there's a lot more in the community who aren't being served, and the current statistics probably underestimate how big the burden is.
Youth mental health only receives a fraction of the total budget that is allocated towards mental health research, but we know that the majority of mental health problems emerge in adolescence. So this is really a developmental period that we should focus on when it comes to mental health research. I'm just really passionate about working in an area where I know that the research that we do has the potential to be directly translated into clinical practice, but also when it comes to policy. And I think we really need evidence-based preventative interventions that can be scaled, but scaled in a way that is safe, that is helpful, and very importantly, non-harmful for young people.
So we've got basically, we know that preventative interventions can be effective, but only in the short term. But actually recently there have been some studies that have shown that preventative interventions can also have harmful effects for some individuals. And that also highlights a big gap that we just actually at the moment are still trying to figure out what intervention works best for which individual, but also what makes interventions effective. So what are the mechanisms within these interventions? So this is the big gap that we in the lab are working on solving. So the type of interventions that we're talking about for prevention are mainly psychological interventions. They can be based on CBT, cognitive behavioral therapy, and they have been adapted and studied in prevention.
I did not even know preventative therapies were a thing till I started working with Josefien and the rest of the team on this specific project, where I was like, oh wait, prevention is actually such an enormous part of what we do. That's where I want to work, thinking about how can we make ethics and AI work together so we do things properly rather than negatively. I'm Sami. I'm the lived experience lead on this project.
So Sami, what is a lived experience researcher and how do you help shape the direction of our research?
I think a lived experience researcher comes in many different shapes and forms. So some lived experience researchers lead specifically on projects and inform how lived experience can be implemented into a project or piece of study. And that's exactly what I'm doing here. My entire role within this is how can I support Josefien and the rest of the team to do this in a non-extractive way, to actually think about ethics and how can we make sure that the people that we are working with actually get something out of it as well, and it's not just us getting their stories.
And what led you to becoming a lived experience member?
A lot of me being a lived experience researcher comes from my own lived experience of growing up in the asylum system, because I knew there were not many people who were coming from an asylum-seeking or refugee background who were talking about mental health within the space, especially because in my own family there's quite a lot of stigma around it. And when it comes to therapy and things like that, when I first started getting therapy, my mom was very against it, and she was like, are you causing problems for us? Just stop doing this sort of thing. But now she's doing a counselling course, so complete switch. But you look at it from that standpoint, it's just about how can we inform research from a lived experience standpoint so it actually meets the needs of the people that we're working for, because it's for the greater good that we do this work, and it's best to make sure that we co-produce and co-design the process alongside them.
As part of my current Prudence Trust's research fellowship, I've carried out a range of large-scale analyses to understand what the effect of preventative therapies is on depression, anxiety, and PTSD. And so we can see so far that they don't work for everyone. So some people improve, and some people deteriorate, and some people stay the same throughout the intervention. Which is exactly the work that the Medical Research Foundation Emerging Leaders Prize will fund, which is to understand why we see those changes within these interventions and for who do we see those changes. Ultimately, we hope this research helps to improve young people's mental health and improve the effects of preventative interventions.
The way in which we can do that is moving away from looking at averages, at what works universally, to what works at the individual level, because we're all different and different approaches might work for different people. So we would really like to come to a point where we're able to recommend personalized approaches for individual young people.
I hope that our research continues to highlight what works for whom and sort of help contribute to overall personalised medicine. So making sure that what we are giving to young people is actually going to work for them.
I agree. I think from my perspective it's also about, with that customisation, it's so much more likely that young people start trusting the systems again, because I feel like in my network and young people that I know, there's such a massive distrust around support services, because it's always like, oh, they're just going to put you on a wait list for a couple of years, then you don't need the support anymore and you move on. But I think this piece of research specifically allows us to enable that level of customization. I think it's one of my first times actually being so engraved into a research project or proposal, all the way from the co-design space to actually now seeing it actually happen. It's a bit scary but exciting, because I know we've got a good team.
It's actually really nice to have today to be filming together and see the whole team in person as well, because it doesn't happen that often. My experience so far has been extremely positive and very inspiring, and I'm only motivated even more now to contribute more for the future. What we really hope for this work to achieve is that we have better personalized approaches for young people by bringing the data together, carrying out the analyses that we plan to do, and bringing partners and young people together. We're moving beyond a one-size-fits-all approach for prevention, and ultimately this work will help improve the lives of young people.